Kristy Garcia. I'm 40 years old and I'm a dental hygienist. Actually, I didn't seek out treatment. Treatment sought me. So I came in here for a regular yearly annual exam, and I guess I'm waiting in the waiting room. Of course, the doctor gets behind with schedule and stuff, and I actually became more irritable and frustrated because I was on my own schedule, and that's when they were kind of like, have you had your blood work done, lab tests done, and kind of evaluated me with that, and then just kind of realized that my hormones were off balance, and that's how that started. But I never thought that pellets could help that. Never even heard of that. So just thought it was just me and just the way that I was. I didn't think it was anything that could be fixed unless I changed my attitude, I guess. I initially started Lumina with the BioT pellets. And I did that because I was moody. I noticed some irritability. I noticed some tiredness and fatigue sometimes. Anyway, she suggested that, and I've actually been doing that for a couple of years. So I started with that. The pellets, I just kind of took a chance the first time. I didn't know. And I noticed, within a couple days, I noticed the difference in that. In me, of course it helps in the gym as well, and that's my thing, so that's my motivating factor. I noticed a difference there, and I just noticed a difference in general, like just with my interaction with family and friends and things like that. So it motivated me to keep doing that. And then of course with fatigue and stuff. So the pellets I've seen like night and day. So I noticed my ability to tolerate other people is somewhat easier when my hormone levels are stable. So that's helped tremendously, and I totally recommend that. I'm even trying to get my assistant to start getting on pellets because I got to deal with her and her moodiness. So. I came in for that, and then of course I told you, found out about skincare, and I had issues with like blotchiness on my face. Found out that she could probably help me with that too, and was motivated because it was in-house and I didn't have to seek somebody else. I could actually do it here. Wow, it's beneficial for me. I don't have to look for another provider. She does it too, so that's what motivated me to do that with her. That she's a really good doctor. She listens to you, and I know what it's like to work on a schedule. I know what it's like to see patients on a schedule, so I understand your limited time sometimes. And I always try to ask her, do you have a minute, so I can explain to you what's going on. And she always has a minute. I feel like even when she doesn't have a minute. So she's really good at listening and really good at, she's a good provider. That I enjoy her as a provider, I really do. And I feel like they're always welcoming. Dr. Loftin's always welcoming. The staff she has is welcoming. And I just feel like the program in general is it's a really good program. And I hope she really does really well with it, because I feel like it's helped me a lot. And I know it can help a lot of other women in general, or people in general. So yeah, kudos to her. Yeah. Right, so when it comes to the athlete, I think, for lack of better words, I think I stick out in the gym. I feel like I look different than the average female, and people ask what I do, and I'm not ashamed to tell them I'm on pellets. I'm on medically regulated testosterone, and I'm okay with that. I'm not okay with illegal steroids. And you can totally tell the difference in the females that are on them and the females that are not. To the regular female, the regular sedentary, ordinary female, like I said, my assistant she's a regular, typical local girl with kids and husband and life going on. And I just feel, even for her, I told her, you need to get the pellets done. Like, it's helped me so much. She's very, very, very irritable, and I know me having to deal with her, I understand, and I tell her, you just need to get it done. She's seen her own personal doctor. They recommended that, and I'm pushing her to do it because I said, it's in the, how do they say, the whatever's in the pudding, the proof is in the pudding. Yeah, so it works. It's good. It's legal, people. It's legal. You'll be okay. It's legal. Yeah, and so I can outbench both of these guys here. So yeah, I can outbench. I promise you. Out squat. Yes. But yes, it's worth it. Yes. And if you need a provider, Dr. Loftin's really good.